Good afternoon, everybody, and welcome to this afternoon's webinar that will present you good practices for the development of harmonized standards under the medical device directives and regulations. Before we start, I would like to remind you about the fact, well, my name is Els, if you never met me here at CCMC, and I will be moderating this webinar. And I would like to remind you also about the fact that you're all muted this afternoon. So you do not have the possibility to speak out loud and shout your questions out loud, but you can use the question and answer panel of the GoToWebinar control panel to submit your questions. So please do so. We will take our time after the webinar, after the presentation, to reply your questions. Should your question remain unreplied, we will upload the answers on the website as well. If you are on Twitter, you're always free to tweet about this webinar and the topic via our handle Standards for EU. So please let me introduce you the three speakers of today. We will start with Jennifer, who is Project Manager in the Energy and Living Standardization and Digital Solutions Department here at CCMC, followed by Catherine, who is the Customer Solution Manager. And then we have one guest speaker today, Agnieszka is Policy Officer at DG Grow at the European Commission. So ladies, please, the floor is yours.
Thank you. Thank you very much, Els, and good afternoon, everyone. I'm Jennifer from Sensenelec Management Center, the project manager dealing with standard development process in the medical device sector. So to take you through the contents of today's webinar, I will give you some background on the EU legal framework, the state of play on the harmonized standards. Catherine will take over the part on the good practices regarding the technical committee work program, the Annex ZAZZ, normative references. Then I will intervene on the good practices on the HAS consultant involvement. Agnieszka will then guide you through the good practices from the perspective of the European Commission. Then we will wrap up with some key lessons learned, and if time is on our side, with the question and answer session. To start firstly on the legal framework surrounding the medical device sector in Europe, there were three directives in the medical sector. Firstly, the Medical Device Directive, known as the MDD, the Active Implantable Medical Device, the AIMD, and the In Vitro Diagnostic Medical Device, the IVD. These three directives have been revised into two regulations, one combining the MDD and the AIMD into the medical device regulation, and the other one on in vitro diagnostic medical device was revised into in vitro diagnostic regulation. These regulations enter into force on the 26th of May 2017, and the rules shall apply after a transitional period of 3 years for the medical device regulation, which would be 26 May 2020, and a transitional period of 5 years for the in vitro device regulation, which would be 26 May 2022. According to the regulation 1025/2012 on European standardization, Article 2(1)(c), harmonized standard is a European standard adopted on the basis of a request made by the Commission for the application of Union's harmonization legislation. Standardization request on the medical device is still at the early drafting stage of the process. Sensenelec was notified by the European Commission that the standardization request will focus on what the European Commission considers priority standards. They intend to focus on the first standardization request. After the next stage of the harmonized standards, the European Commission is considering developing other standardization requests which would cover product-specific standards. The priority standards included on the first standardization request are Quality Management System, EN ISO 13485, Risk Management, EN ISO 14971, Labeling Symbol, EN ISO 15223, Clinical Investigation, EN ISO 14155, Biological Evaluation, EN ISO 10993, and the medical electrical equipment EN 6001. This draft standardization request implies that the update of Annex ZA and ZZ by the technical committees can be updated during the transition period, and it also means that standards may include 2 or more Annex Z, each indicating the relevant legislation, either MDD or the MDR with their corresponding mandate. Just to give you some statistics for all the published candidate harmonized standards under the 3 directives, 10 new standards were cited, 74 standards were rejected, and the reasons for the non-citation is that there is approximately 35 European standards without Annex ZA or with a wrong Annex Z format. And also there were issues with referencing, such as presumption of conformity were claimed by reference to other standards, and there were also issues with the undated normative references. The main guidance from the European Commission on the rules and workflow on the development of harmonized standards and standardization requests are provided on the Blue Guide on the implementation of EU product rules on the section of harmonized standard, and also on the European Commission Vademecum on standardization requests, Part 3 guidelines on the execution of standardization requests. Now I'll give the floor to Catherine to guide you through the good practices on the technical committee work and the other parts.
Good afternoon. So yes, this is Catherine speaking, and yes, we're gonna go through different good practice. The first one being the technical committee work program and its update. Then I will mention some keys about Annex ZA-ZZ. Then I will jump on normative reference. Then I will also briefly mention how to involve the HAS consultant in the development process of standards, and then Agnieszka will give us some info or EC views regarding medical devices regulations and directives, or on best practices for standards. Regarding the TC work program, before going into the details of the work program of technical committees, let's briefly clarify the link between EU legislation and harmonized standards. Linked to new approach pieces of legislation, the European Commission issued standardization requests that were previously named mandates for SANEC to support and complement European policy objectives. As you may know, a standardization request is a legal act from the European Commission and is considered as a contract between the European Commission and SEN and or SENELEC. It is then, it is thus binding for parties, and in particular, as a consequence, the deadlines set in the contract for the deliverables are binding and are to be respected. In line with the standardization request, SENELEC developed standards in support of the concerned legislation, and during the development process, the standards are assessed by independent experts called HAS consultant. We used to call them new approach consultant, but now they are called HAS consultant, but we will come back on that. If those standards are positively assessed, the standards are offered to the European Commission for citation in the official journal of the European Union. But it might be worth to recap a little bit how a work program of a technical committee is set up. And let's start by assessment then and then back. So, before the acceptance of a standardization request, as you know, the European Commission is responsible for the preparation and drafting of the standardization request. This is done in line with the principle included in the Vademecum on European standardization, mentioned some slides ago by Jennifer. And what is crucial is that all the relevant parties are included in the drafting process and consulted during the consultation. While the European Commission set the contents and the deadline of the standardization request, These content and deadlines are developed and drafted in close cooperation and consultation with the European Standardization Organization, namely SENEC and ETSI in some cases, and other relevant stakeholders. The consultation phase, from SEN and SENEC side, is also in close cooperation with ISO and IEC or international counterpart. This consultation with ISO and IEC is also crucial as to ensure that the future work is properly planned and thereby taking into account through the provision of the Vienna and Frankfurt agreements. To ensure a prompt coordination of the input from SEN and SENELEC side, it has been decided to establish standardization request ad hoc groups. Those ad hoc groups are composed of SEN and SENEC technical board members, relevant technical bodies, relevant SEN and SENEC stakeholders, ISO and IEC whenever relevant. It means that already at that stage, when the standardization request is drafted, technical committees have already a good idea on the implication and the consequence of the upcoming standardization request and also its consequence of their work program. TC can then start anticipating the work. This standardization request at the group advise the SEN and SENEC technical board on any issue that might pop up from the drafting of the standardization request and ultimately advise the technical board on the acceptance or possible rejection of the standardization request. Should the technical committee have any issue or question regarding the setting up of this ad hoc group, just contact your relevant SEN SENEC Management Center project manager. The project manager in CCMC is really the contact point or the bridge between the TCs and the European Commission, so feel free. Now, after the acceptance of the standardization request, a work program has to be delivered to the European Commission. This is often part of the text of the content of the standardization request. This work program contains all the projects intended to be offered to the European Commission and their deadline. This work program is drafted by CCMC, but of course in close collaboration with the concerned technical committees. The work items mentioned in this work program are also then in the technical committee work program and are therefore linked to the relevant directives and regulations and standardization requests in our database. The point here is that technical committees have to monitor their work program and their link with legislation and regulations and directives, on a very regular basis. This is really an invitation to our technical committee. So please use Projects Online or the website to check whether your work program, your respective work program is okay. And keep the data regarding your work items updated in the database. And if you spot any possible mistake, please contact the SEN SENEC Management Center and your program manager. If you see also a need to adapt the work program accepted or sent to the European Commission, please inform your program manager so that your program manager can check with the European Commission desk officer the possibilities. This slide is just presenting an example of our work item or our project is represented on the website. This is a SEN example, but the same structure is followed on the SENELEC website. And you see that below the regular information like scope, status, and so on, you have also the indication of maybe not clear enough, but in blue, the link of this work item to any directive regulations and the standardization request, which is still referred to here as mandates. Another crucial aspect of harmonized standards is the Annex ZD-ZZ. An Annex ZD-ZZ is an informative annex of a standard, making the correspondence between the essential requirements of a directive or regulations aimed to be covered and the applicable clauses of the standard. Then an important point. This informative annex is called Annex ZA in CEN and Annex ZZ in CENELEC. This Annex ZA ZZ has to follow an agreed format accepted by the European Commission and CEN and CENELEC through the technical boards. There is first an introductory part referring to the concerned legislation and the standardization request, and then a 3-column table. The technical committee is the one responsible to fill this template or this agreed format and to refer to the correct legislation and correct standardization request. Now, if your standard covers several new project directive regulations, it has to have several Annex ZD, ZZ. In addition, it is important to note that each part of a series of standards that needs to be listed in the official journal has to have an Annex ZZ, ZA. For instance, if there is an EN 123-1 and a second part which is an EN 123-2, and if the TC wish, or if both standards are in support of EU legislation, it means that you wish to offer both to the European Commission. It means that both parts need to have an Annex ZZ-ZA. Templates of this Annex ZA-ZZ are available on the website of CEN and CENELEC. You have here the link to the relevant page of CEN and CENELEC. And you might also be interested to know a little bit more. And for that, we have already had several webinars. For instance, we had a webinar in September 2017 on Annex ZA-ZZ to CEN and CENELEC standards. And as you may remember, and I'm sure most of you have already participated to the webinar we had 1 year ago in February 2018 on the do and don'ts of drafting medical devices harmonized standards. And part of the webinar was also dedicated to Annex ZA-ZZ. The next slide, yes, you'll see here an example of an Annex ZA, a template on the left-hand side, and one which is filled in on the right-hand side. As you will see, it's a 3-column approach. The first column is the general safety and performance requirements on the left column. And this is in accordance with the template. Then in the middle, you have the clauses of the standards. And on the third column, you can add additional information. Go to the next slide. Yes, this is what I've said. Please place the rows in order of the general safety and performance requirements. Put yourself in the shoes of the reader. For readability purpose, this is relevant, it is helpful. Where necessary and appropriate, split the general safety and performance requirements into individual indent or parts, or even separate sentences or phrases, also for readability purpose. And if extent of coverage described in the right-hand column. So that was it for the Annex ZA-ZZ. If we go to the next slide, we will jump in the normative references. This is, of course, an important aspect when developing a harmonized standard. So a document to which reference is made in the standard in such a way as to make it indispensable or mandatory for the application of the standard is called a normative reference. There is a full chapter dedicated to normative reference in the CEN-CENELEC Internal Regulations Part 3, which is Principle and Rules for the Structure and Drafting of CEN and CENELEC Documents, which is based on ISO and IEC directive. And in principle, any reference document should be those published by CEN, CENELEC, FC, ISO, and IEC. In exceptional cases, and when it is not possible to include the relevant text in full, nor to use European or international standards, the use of other documents as a normative reference is accepted, provided some condition, but I will not describe this here because we have also many guidance on the CEN and CENELEC website. To jump in the core of wait, I'm lost with my, just go up. Voilà. To jump in the core, undated references are referred to in the clause 10.4 of the CEN/CENELEC internal regulations, and undated references are allowed only when referring to a complete document and possible to use all future change of the reference document for the purpose of the referring document, and the reference will include all the amendments to and revisions to of the reference document. This is a copy cut of the internal regulations part 3 of CEN and CENELEC. Now, dated reference. You need to date your normative reference when the conditions mentioned in the previous slide, so when the condition mentioned in clause 10.4 of the internal regulations are not met. Please note that if references to undated draft or EN are included in an EN developed in the framework of new approach directive regulations, you need to be aware of, technical committees need to be aware that the European Commission might not wish to cite that EN in the official journal of the European Union, and this is clearly mentioned in the European Commission Vademecum. Reference document amended or revised, review the dated references, and assess whether they should be updated or not. The dating of those normative references to be done within the text. And just for your info, because normative reference can be a long topic, there is already a work ongoing within the CEN/CENELEC BT Working Group 12, which is Harmonized Standards and the European Regulatory Framework. There are work being done there, and some pilot cases from various sectors are selected to see whether for some references or normative reference, whether some of them could be undated under very specific conditions. So there is work ongoing. Now, some also important aspects when considering normative reference. The number of normative reference in an EN should be limited to the minimum needed for the application of the standards. Therefore, informative references shall be listed in the bibliography. Normatively referenced documents shall have reached at least the inquiry stage. Normative references to inquiry or final draft are potentially risky and discouraged, as the reference document may change before the publication. This is really, this is risky. And the committees, the technical committees, should validate all reference documents when the document is revised. Now, in the medical fields, many standards are developed at international level, whether it is ISO or IEC. In this context, for EN-ISO standards and EN-IEC, a table of correlation between the current EN and either dated or undated ISO standards listed as normative reference should be added to the European pages of the standard, the European one. This correspondence, this table of correlation between, let's say, the IEC ISO normative reference and the CEN or CENELEC normative references is the responsibility of the CEN and CENELEC technical committees, because this is part of the normative text. For EN-ISO standards, the correlation table is in the European forward, and for EN-IEC, the correlation table is in Annex ZD. Attention, Annex ZD in CENELEC is not Annex ZZ. Just to make things a little bit more complex, in CENELEC, the Annex ZD is making the correlation between the normative reference of IEC and the normative reference of CENELEC. And then in CENELEC, we have the Annex ZZ making the correspondence between the essential requirements of a directive regulation and the clauses of the standard. In CEN, we only have an Annex ZE This is making the link between the essential requirements of the directive regulations and the clauses of the standard, just to make it a little bit more complex. If you are lost, or not yet, we have additional information available. We had a webinar for standard writers, which was called Normative Reference Terms and Definition. It was in 2016, but the content of it is still valid. And we had a webinar, we will have a webinar in May, on the 10th of May. And the webinar, the 10th webinar, so it means on the 10th of each month at 10 o'clock for half an hour. And this webinar will be fully dedicated to normative reference for harmonized standards. So now I will give the floor to Jennifer, who will give us a little bit more info on HAS consultants. So as you may remember, HAS consultants who are those consultants that we used to call new approach consultants. Jennifer, the floor is yours.
Thank you, Catherine. Until April 2018, Sentinelec were managing the contract of the new approach consultant. Now, this new approach consultant have been replaced by a new system called the Harmonized Standard Consultant, commonly known as the HAS consultants. And this new system is under the responsibility of the European Commission, with no direct link of Sentinelec Management Center. These HAS consultants are independent experts selected, hired, and managed by the new HAS contractor, Ernst & Young, and they are required to perform the identified task, which is to make the compliance assessment of the document drafted by the ESOs and to communicate with the technical body of the ESOs to give advice in order to contribute to the compliance of the drafted document. So, for example, should a technical committee wish the attendance of an HAS consultant to a working group or to a technical committee meeting, the TC secretary is invited to fill in the request on the web page. But you have to note that this request made to Ernst & Young has to be related to a specific project, therefore a work item that is mentioned on our database. When can the assessment request be done? There are 4 stages. Firstly, at the drafting stage, this is at the request of the TC, at the inquiry stage, and at formal vote stage. But it's important to note that at inquiry and at formal vote stage, the request is done automatically by CCMC after the reception of the draft by the technical committee and after the draft has been edited by our CCMC colleagues. And exceptionally, an assessment can be requested on a document that have already been voted upon, only if the changes that are made are to the Annex ZA and Annex ZZ. But this also is done upon the request of the TC. So in principle, there are 3 assessments per draft standard, and the duration for the assessment request is 5 weeks after notification to the HAS contractor. This is to show you the development and time frame of a standard development process. As you can see, CCMC is requesting the assessment before the inquiry and before formal vote. However, like seen in like I said in the previous slide, an assessment can be requested at the drafting stage. Therefore, the TC secretary just have to make a request to the project managers, and we can contact the contractor to request for an assessment. And now I will give the floor to Agnieszka to guide you through the good practices from the Commission's point of view.
Good afternoon, everyone. Well, first, maybe I will just complement shortly to what has been said by Catherine and Jennifer. So regarding the draft standardization request for the regulations, we are planning to very shortly consult formally CENELEC. I mean, we had some exchanges regarding the list of standards in the past, but the letter is, I can confirm, already ready. It's just the matter, I think, of pressing a button, so it should arrive to CCMC very soon for a formal consultation. This coincides a little bit with the date of the meeting of the Committee on Standards on the 5th of March, when the parallel discussion and also a vote is envisaged on the draft mandate for the personal protective equipment, PPE. I say this because that second mandate sort of creates a blueprint for future standardization requests of the Commission. So in our draft, we have also followed that blueprint, and depending what will come out of the 5th of March, this will be also reflected in the mandate for medical devices. So I'm saying this to somehow also let you include any comments that will follow from that discussion in 2 weeks' time, a little bit less. So this process is done in parallel and in a somehow consistent way. I also would like to mention, Jennifer indicated the guidance which is already available in the Commission on standardization in general, VADC being the sort of a main document. In the communication on the standardization towards the end of last year, it was indicated the Commission will issue additional supplementary guidance. So I also would like to very shortly brief you that the draft is already under discussion. To my knowledge, that guidance document will try to also explain the consequences of the recent case law of the European Court of Justice on harmonized standards, which then in turn also explains the consequences or the changes in the policy of the Commission regarding standardization, and this standardization mandate being one of the examples. So this new form, which is much more precise and definite. The first slide of my presentation that you see on a screen, it's well, I have not indicated, but maybe you will recognize that it is a provision on harmonized standards in the new regulation. This comes from MDR, but the parallel provision is in the IVDR. And at this point, maybe also as a sort of introduction, I would just mention that as regards the transition period, the key date for MDR is, of course, May next year. As of that date, the devices which are not subject to conformity assessment by notified bodies will have to conform to the regulations, whereas the devices which are subject to certificates issued by notified bodies and in cases defined in the legislation, they will be able to be placed on the market on the basis of certificates still issued under the directives for a certain period of time, the longest period being 2024, which means basically, well, still a suitability of the standards developed under the directives for the purpose of the certificates, which will remain valid. But what has to be emphasized that after 2020, in principle, there are no possibilities to issue new certificates and to make significant changes to those certificates. So this is very relevant because it basically means retaining status quo, but not, let's say, a continuous life and modification of a certificate. Now, turning to MDR and IVDR. To say in general, the role of harmonized standards under the new regulations is retained. As you may probably know, there is a possibility of, let's say, supplementary or parallel instrument, common specifications that may be issued by the Commission, which could play a similar or the same role. For the moment, this is not really envisaged, but that possibility exists if there is a need. At the same time, there is also a significant, I would say, extension of the possible scope of harmonized standards. As highlighted here on the screen, they could provide for technical specifications, not just for manufacturers, but also for economic operators with regard to some system or process requirements. I think this is a significant change because normally a harmonized standard does not set out common technical specifications for economic operators. Here it is expressly permitted. However, to be emphasized that, of course, users of devices are not amongst those to whom a harmonized standard is to be addressed. So I think this is one of the key messages that have to be kept in mind when drafting standards. I think also as a bit of a general reflection, I think the whole challenge that we face when harmonizing standards in the field of medical devices is the fact that, as has been already said today, they are developed at international level, at ISO level, IEC level, which is not really, let's say, reflected in the EU legal framework. The standardization regulation 1025 says that Commission requests the European standardization bodies to draft standards, and the drafting of European standards takes place intensively in other sectors. In our sector, it's more of an exception. And I think that this leads then to this challenge of trying to find a bridge between those two frameworks and see how to accommodate the needs of either side. Here already a question appeared in the meantime, which I'll read out. How does the EC know that it needs to provide a standardization request for a new standard or a revised standard? So in principle, this standardization regulation 1025, as I have said, foresees that Commission comes with a request to European standardization organizations. So there is an assumption that somehow the EU regulators, so persons like me sitting at their desks, they have this perfect broad perspective of the legislation and all possible needs of how this legislation should be implemented, and then it goes to ESOs. In reality, it's not really the case. I would say it's rather the other way around, that especially in the field of medical devices, ISO and IEC develop standards, and participation of European regulators is rather limited, and of the Commission is even less. When it comes to what is supposed to be harmonized, I think it's in let's say, daily practical interactions between the Commission and ESOs, but also other stakeholders. For instance, now when developing a draft standardization request for the new regulations, it was discussed in the expert group, medical device coordination group under the new regulation. So it is an expert group composed of high-level officials from a regulator side from different member states. And this is how this prioritization approach, also mentioned today, emerged and finally was endorsed as the proposed way forward. Now, when it comes to more specific filling in of that list, that basically took place through exchanges between CCMC and the Commission and other stakeholders, and also different comments of persons who have been interested and simply submitting those suggestions in meetings or in exchanges. All right, so now I would like to pass maybe a few practical comments regarding the development of standards, keeping in mind that they are mostly drafted at international level. However, many European representatives participate in that process, so maybe they have an opportunity also somehow to influence it. And I would just maybe do it with reference to some particular examples. You may consider them as specific, but hopefully they will reflect a little bit of the philosophy and considerations that we make when we actually think what should be harmonized and what should be a content of a harmonized standard. So some let's say key questions: to whom the standard is addressed? What is the scope of the standard, and why is the harmonization of a standard needed? And I would make here a reference to one particular standard which is mentioned in the IVDR, actually in a I will scroll to the next slide, in undated version. And it is a slide which is a copy paste of the provision of the IVDR on so-called in-house manufacture IVDs, so basically in vitro diagnostics that are produced by medical laboratories. And in specific circumstances, this can take place, let's say, outside of the scope of the IVDR regulation. So IVDR says when this is allowed, and it says, well, yes, but then certain conditions must be fulfilled. And then one of those conditions is this particular ISO standard on medical laboratories. And in this context, there was one of the feedbacks which we received when drafting a standardization request was, well, this standard should be harmonized then, if it's mentioned here. Well, the answer is, from our point of view, no. Why? Because this legislation makes already the use of that standard mandatory. So this particular standard, and here it doesn't mention any edition, any version, this is already mandatory for labs when they are involved in manufacturing of in-house devices. Now, the question would be, all right, but for us, the important is not the exception, but the main, let's say, setting when we are talking about IVDs which are subject to regulation, so not in-house manufactured ones. And then our reply would be, we have a problem here because according to Article 8 of the MDR or corresponding article of the IVDR, a standard cannot be addressed to a user because for normal IVDs, a lab will not be a manufacturer. It will be someone else. So I think that this concept already, or this example reflects a little bit of the philosophy of addressee and of the, let's say, voluntary use of a standard as an instrument which can be used in order to comply with general safety and performance requirements. I will just skip quickly because the next slides explain on what I just said to the next slide, which explains or reflects the issue of what the standard has to be about. The standard sets out technical specifications for medical devices, meaning or devices, because the MDR can go a little bit broader, but I will not discuss this today on which context some other products can be considered as devices. But in principle, other products that are not considered as devices are not subject to harmonization, even if European or ISO standards can well exist for them. And one such example could be here mentioned, a standard for washer disinfectors. there is a definition in the standard of a washer disinfector, and it's a machine intended to clean and disinfect medical devices. So it's clear that it's not a medical device as such. And perhaps that standard can be very useful. However, a role of harmonization of a particular standard is to enable a manufacturer of a medical device to benefit from presumption of conformity. So a manufacturer of the machine which is intended for cleaning and disinfecting medical devices, it can be, as I said, a very important element of the whole process, but its manufacturer does not really have to comply with the MDR or IVDR or previously the directives. And just to reflect a little bit, okay, no, now maybe I will go because I see also that the time is running, so I don't know how much we will have for the Q&A session, but let's continue and then we can maybe just note down any questions and reply to them later. Another aspect which would be recommended from our side to be kept in mind when developing or let's say refreshing, aligning standards for the MDR, IVDR. There are standards which are bundled, and I think the 60601 family is the best example of such bundled standards. But also in the SEN standards, there are, let's say, combinations, meaning standards which have to be applied together in order to benefit from presumption of conformity and to really fulfill a particular essential requirement. In such case, it has to be reflected, and the Annex Z would be the most suitable document to do it, to indicate to the user that compliance and fulfillment of essential requirement can be only achieved by parallel, simultaneous use of both or maybe more standards. I think that has not been the case up till now, and each standard has been somehow listed in OJ on its own. But we have looked a little bit, and actually there is an example in the machinery sector where standards are grouped according to type A, type B, type C, and then there in the official journal, in the publication, there is an explanation of each category of standards, and I will just quickly show them. So there is type A, which does not really enable, these are the most general standard, let's say higher level standards, which does not enable a presumption of conformity on its own. Type B, so somehow being in the middle, and type C, which are the most specific ones, and those which are relevant for presumption of conformity, unless something else is, let's say, defined in type A, type B, or if type A and type B have to be applied in parallel. So I think that the general recommendation would be to indicate in the Annex Z which standards have to be applied together with a particular one, because on its own it will basically not allow to fulfill a particular requirement. Another practical example, going more into some, let's say, more some issues that we have come across. A standard, in a definition in a standard cannot set out technical specifications. I think this is also in line with the internal regulations on drafting standards. And here an example is given. It's about a quality of dialysis fluid for hemodialysis. And there is a definition of a dialysis water, which, by the way, is not, let's say, the main subject of that standard. And it states that water it is water that has been treated to meet the requirements of a particular ISO standard. And then there is an Annex Z in that standard, which actually already referring to this clause already indicates which essential requirement has been fulfilled. This is not really correct for the reason that this definition, it includes the reference. Probably it should be considered as a normative reference. But that, I mean, is it a definition or is it already a requirement, a technical specification, meaning that this has to be applied in order to comply with this very standard? So probably this is not the best place, and moreover, the Annex Z should not claim coverage of that essential requirement because the whole content is included in another standard. Now, again, something quite important for developing standards for MDR and IVDR. The standards cannot repeat legal provisions. And this may have quite some consequences for few important standards. And I'm not sure, actually, I don't know, I don't have any idea at all what is being done at current moment. But there are standards, and the standard on good clinical practice would be a good example of that, which actually basically repeats many provisions of EU legislation. And that would be, under the existing rules, not really allowed. And I think that this will have to be taken into consideration now when aligning the few standards which could be affected by that problem. And I would just show on an example here the references to these particular standards in MDR and IVDR. They basically explain that the rules of MDR and IVDR, which are much more extensive to what we have now in the directives, have been based on this particular standard. Now, if we have those rules in MDR and IVDR, this does not, of course, preclude a standard which would be suitable for harmonization, respectively, under one of the two regulations. However, such standard should complement and not repeat the legal provisions of EU legislation. So here, the next slide, we indeed just basically reflects where these requirements are included in the two regulations. Another example of such an issue would be a very frequent repetition of labeling requirements in product-specific standards. And here, because they are developed at international level, those listings of the labeling particulars are also, let's say, not 100% precise. Sometimes they give options. Sometimes they have, let's say, clauses such as normally or in principle. And I must say that I struggle a little bit here, because this will mean that such kind of listings may not be compatible with what is stated in the new regulations because of those alternatives, for instance. And the main rule, the standard, should not repeat legislation. Well, I don't know. For this specific issue, I think that we have to consider a little bit what we are going to do if inclusion of those labeling particulars is a standard practice for ISO and IC standard. One possibility would be exclude this part from harmonization. To avoid rejection of a standard because of, let's say, in compliance with what is in our regulation, possibly to say, well, that this part is excluded from harmonization. But this is one possibility. I don't know. Maybe we need to discuss a little bit what could be done. And maybe just very quickly some few final comments. Yes, the normative references have to be specific. Catherine said quite a lot about references. here an example is given of a clause. Maybe I'll just not read it, but you can go later on, come back to this particular example, where a reference is, I mean, this is this particular case of 60601 family, where a reference is made in a particular standard to the general one and to the collateral one, but it is done in a such imprecise way that basically a user has to do as kind of own investigation of which collateral standard would be relevant in this particular case. And from our point of view, we don't believe that kind of references are sufficient and are clear for the users. I think I'm just trying to see what else could be. Yeah, just to finish up quickly, to flag and to emphasize, there are family standards, standard families which are particularly affected by the issue of normative references, and I have mentioned here 10993, so very important family of standard on biological evaluation, which is a definite candidate for the forthcoming alignment of the for the MDR IVDR. However, those standards include many normative references which will require an update, so I would just to flag this. And maybe a final comment on the test methods, where standards are setting out test methods. Please indicate in Annex Z that probably, this would be my guess, a test method alone will not enable fulfillment of a particular requirement, but is only a tool, and maybe the standard needs to be applied together with another standard which contains, for example, the relevant parameters. So this is all from my side. We go now to the key lessons.
Yes. So yes, this is like, let's say, the conclusion of today's webinar, which we try to cover many things. But to sum up, I would say that an updated work program from technical committee side is crucial. So it's the TC technical committee responsibility to monitor their work program, and you know that if there is anything, please contact your Sensenec Management Center project manager. Regarding the Annex ZD-ZZ, it's a 3-column approach. On the left-hand side, the general safety and performance requirements, the clauses of the standard in the middle, and then additional info if needed on the right-hand side. Please ensure that the general safety performance requirements covered are clearly explained, and do not forget that there are as many annexes ZA-ZZ as regulations directive aim to support. What is also crucial is involve the HAS consultant as soon as possible. Contact the contractor, namely Ernst & Young, through the link given some slides before. The dating of normative reference is the preferred way. An informative reference should be in the bibliography, not in the normative references clauses. ENs should complement legal provision, not repeating them. And of course, if questions, contact